What if I told you that the itching keeping you awake at night is not just dry skin, that the persistent urge to scratch, the discomfort you try to ignore, could be an early warning sign of something far more serious happening inside your body? This idea may sound unsettling, but it is one that medicine wishes more people understood. Because there is a silent danger many people overlook, a signal your own body sends long before pain appears. And when this signal shows up in very specific areas, ignoring it can cost valuable time. Persistent itching is often dismissed as an external problem, a new soap, aging skin, an allergy, and sometimes it is exactly that. But the skin is not just a covering, it is a mirror, one of the largest organs of the body, and it often reflects problems developing deep inside organs that do not hurt until damage is advanced. The liver and the kidneys are prime examples. These organs filter toxins, regulate fluids, and maintain balance. When they begin to fail, they rarely cause pain at first. Instead, they send subtle signals. One of the most common is unexplained itching. Over many years in clinical practice, one pattern appears again and again. Patients arrive with advanced liver disease or severe kidney damage. And when their history is reviewed, there is often one symptom that was present for months or even years. A relentless itch that never went away. This itching was treated with creams, with lotions, with home remedies, everything except a search for the real cause. The first location that should raise concern is one that surprises many people: the palms of the hands and the soles of the feet. When intense itching appears in these areas, especially at night, and there is no visible rash, redness, or dryness, this is a major warning sign. This type of itching often feels deep, as if it comes from inside the body rather than the skin. This pattern is strongly associated with liver dysfunction. The liver produces bile, which helps digest fats and eliminate waste. When bile flow is disrupted, certain substances build up in the bloodstream. These substances irritate nerve endings in the skin. For reasons still being studied, this irritation is felt most intensely in the palms and soles. This condition can appear long before jaundice, pain, or obvious liver failure. Ignoring it can delay diagnosis until the disease reaches an advanced stage such as cirrhosis or severe bile duct obstruction. The second pattern is a generalized itching that affects large areas of the body. This type of itching often involves the back, chest, legs, and arms. It may come and go, but it is persistent and intense. It does not respond to moisturizers. It worsens at night. It drives people to scratch until the skin breaks. This pattern is commonly associated with chronic kidney disease. When the kidneys fail to filter waste properly, toxins accumulate in the blood. Mineral balance becomes disrupted. These internal changes trigger widespread itching known as uremic pruritus. Kidney disease is especially dangerous because it progresses silently. A person can lose more than half of kidney function without clear symptoms. By the time swelling, extreme fatigue, or abnormal labs appear, damage may already be severe. In many cases, itching is one of the earliest signals. The third and most deceptive pattern is localized itching in one specific spot. This may involve a mole, a dark spot, a rough patch of skin, or a small lesion that never fully heals. The itching is not dramatic, but it is persistent. It keeps drawing attention to the same area. This can be an early sign of skin cancer. As abnormal cells grow, they release substances that irritate nearby nerve fibers. In some cases, itching appears before obvious visual changes. This is why any lesion that itches, bleeds, changes color, grows, or refuses to heal should be evaluated promptly. The classic warning signs of melanoma include asymmetry, irregular borders, uneven color, large diameter, and evolution over time. Persistent itching deserves a place on that list. In rare cases, generalized unexplained itching can also be associated with internal cancers such as lymphoma. While uncommon, this reinforces an important principle. When itching has no clear explanation and does not resolve, it deserves investigation. At this point, it is important to pause. Most itching is not dangerous. Dry skin is common, especially with age. Allergies, stress, and mild dermatitis account for the majority of cases. These usually improve with hydration, gentle soaps, proper skincare, and time. The key is not fear. The key is pattern recognition. You should seek medical evaluation if itching lasts more than 2 weeks without improvement. If it is intense enough to disrupt sleep. If it does not respond to basic skincare. If it appears in the palms and soles, is widespread and severe, or is localized to a changing skin lesion, especially if it is accompanied by fatigue, weight loss, swelling, yellowing of the skin, night sweats, or loss of appetite. In these cases, simple blood and urine tests can reveal problems early. Early detection changes outcomes. It turns irreversible damage into manageable disease. Your body communicates constantly. It rarely fails without warning. Itching can be a minor nuisance, or it can be your body asking for help. The difference lies in knowing when to listen.